welcome to tonight's Spinal Cord Injury Forum. My name is Jeannie Hoffman. I'm a clinical psychologist and professor in the Department of Rehabilitation Medicine and the former director of the Northwest Regional Spinal Cord Injury Program here at the University of Washington, turning it over to my colleague Heather Barnett, who will be with us in the future, so you'll get to know her soon. Tonight we are so excited to welcome our guests to discuss pregnancy after spinal cord injury. And so I really welcome our panelists, and I'll do a brief introduction and get us started. Tonight have the luck of having some fantastic folks with us. We have Dr. Debbie Crane, who's a spinal cord injury physician based at Harborview Medical Center. We also have Nick Burns, who is an instructor in the maternal fetal medicine group here and works with a lot of our interesting moms who are coming in to give birth. We also have Jessie Owens, and Jessie has a function-wise, you're about a C5 injury, and so with central cord syndrome, and she actually is amazingly wide awake and everything with her 4-month-old babies at home. So very recent pregnancy and recent experience. We're also lucky to have Vanessa Bartlett join us tonight, and she has a T10 complete injury and has a 2.5-year-old at home, but still remembers a lot of details about that pregnancy and all the fun of this. So thank you all for being here tonight. And I really wanted to just start tonight and really going back to that early injury. So Jessie, I think you're about 10 years post-injury. Vanessa, 17-ish years post-injury now? About 7 years. Oh, my math is totally wrong. Sorry. 7 years. Anyway, so I wanted to start with Dr. Crane. I'm curious about that early after injury, when you start bringing up the topic with people, or do individuals with spinal cord injury, women, it's a rare group in a rare condition, and yet people of childbearing age, oftentimes that's a topic of discussion. And so are you finding that discussion happening like early after injury in inpatient rehab, or are those discussions happening along the way?
Yeah, I think it's quite variable. And as you said, women of childbearing age are not the primary group or demographic that typically gets spinal cord injury. So it doesn't come up that often as far as women asking. I usually take the lead of the person that has a new spinal cord injury. And typically my practice will be to, when I'm meeting someone or when someone has a brand new injury, sort of reassure them that, this injury happened. Obviously it causes changes in life, but that they can continue to have lots of normal experiences, including having children biologically. And then I'll sort of take the lead of the individual. Sometimes people really want to know a lot of specifics, and other times people are like, that's fine, it's just you're telling me it's not out of the question. Great, I'm going to deal with all these other things I have in front of me, and I'll revisit that in the future. So I kind of take the lead of the individual.
Yeah. Jessie, do you remember that conversation early, or when did you first kind of think about or want to know about pregnancy after spinal cord injury?
I do remember that, and I had that conversation with Dr. Crane almost 10 years ago, and I was kind of in the second column of what she was talking about. I was 27, I was single, but trying to envision what your life is now going to look like. You have so many changes, your job, your body, your autonomy, and you kind of want to think about what's in front of you. And I said, is this off the table? Like, can I not do this anymore? And she was like, well, you can. Do you want to know more? And I was like, not right now, thank you for the answer. And revisited it when I was more ready to have children.
Yeah, that's great. How about you, Vanessa?
Well, I think I touched on it with Dr. Crane after my injury and after I got out of rehab, but I originally first asked Dr. Aaron Bunnell, who was there with me in the inpatient rehab process, and he was very reassuring. That was kind of one of the first questions my parents wanted to know. And I wanted to know, and I was with my husband, my now husband. We had been dating for 2 years at the time, and yeah, kind of like Jessie said, I just wanted to make sure it was possible and that it was okay, and I didn't get into any specifics. I wasn't ready to have children at that time.
Yeah.
Mm-hmm.
So, Dr. Crane, did those questions come up a lot in outpatient as people are preparing, or or do you sometimes find out people are pregnant kind of after the fact, after that they've already gotten pregnant, or maybe even after they've had kids?
So again, I wouldn't say they happen a lot because there just are not that many women that I work with that are of the age range that would be having children or wanting to have children. But I work with a handful of people that are actively trying to become pregnant. And typically with me, they'll bring it up kind of like letting me know, and then wanting to just say like, what should I do? Sometimes it'll come up with we're working on some other issue related to spinal cord injury, and they might be hesitant to try a new medication because you worry about medications and pregnancy with different types of medications. So that'll sometimes come up, and I'll kind of give them provide some education. And then in other cases, I find out after the fact. Often the OB provider will just copy the note to whomever else is in the patient's sort of record of providers. So that is often how I find out that someone is pregnant. But I do have, I think, 3 people that I can kind of think of off the top of my head that are all hoping to become pregnant that will bring it up, and we'll kind of talk about some things to consider.
Yeah. So, starting maybe with you, Vanessa, like planning. I mean, so you were dating somebody, getting married, thinking about family. How much planning did you do in terms of getting ready for the discussions with your SCI group or not?
So we had it all planned out. My husband and I got married 4 years ago, so 3 years after my injury happened. And we were gonna get pregnant in January of 2020. And I wasn't using birth control, I was using the ovulation method. I had like a tracker, but it didn't always work out. And so anyway, long story short, I ended up getting pregnant in July of 2019. And so it was a few months early, and I was very shocked. I was in a lot of shock, probably 2 days of just staring out the window, thinking about how my life was about to change radically. And then we just rolled with it, and obviously it's the best thing that's ever happened to us, and we're very blessed to have a healthy, beautiful baby girl.
Yeah, that's wonderful. Jessie, how about you? I mean, so Vanessa had the we're going to do it, but oops, we did it. For you, Jessie, how did that process go?
So my story is a little different. I met my husband post-accident, and so we dated, and while we were dated, we talked about whether we wanted children, and we both were not definite yes, and both were not definite no. And as the pandemic happened, and we grew closer and lived together, and kind of seeing the best and the worst of what it's like to live with a spinal cord injury, we decided that we wanted children. And so we were going to have a pandemic wedding too in 2021. And we decided to start trying. And so I'm 37. So we tried for about 6 months with nothing. And then we went to a fertility clinic to get things checked, thinking they say after 35, I believe, you're supposed to go if you've been trying for 6 months. Turns out everything was fine. They said, you look good, keep trying, but if you want to do IUI, you can come in on Thursday. So 2 days later, and I was like, okay, sure, I don't have anything on Thursday. And we went and did IUI, and 3 weeks later, we were pregnant. So either I was already pregnant for the IUI, or the IUI worked, and it really worked for 2 babies. So
yeah, excellent. So Dr. Burns, talk a little bit about the people come to you when they're pregnant typically, right? Early pregnancy. What are the kind of things that you're thinking about and talking to folks about when they have a spinal cord injury?
Yeah, I mean, if there was a maternal fetal medicine wish list, first of all, it would be for a preconception visit with anybody with concerns prior to pregnancy. But as your story, Vanessa, goes, that's the story with 50% of people with pregnancies, is they happen in an unplanned or unanticipated fashion. And so for folks with any complex medical condition, someone like myself in maternal fetal medicine likes to see them at the start of pregnancy to review a lot of the very common concerns. And those go even beyond folks with spinal cord injury. Medications are always a huge top of line concern. what's safe in pregnancy, what's not, what do we have data on, what do we not have data on, what new medications do I need to start, or what new vitamins or supplements or other things. Very early with spinal cord injury, we often start thinking about the other essentials, bowels, bladder, and some of the risk factors that come on with pregnancy. And so even from the early onset, we're starting to try and think about things that will optimize your life while you're pregnant and lay good groundwork ultimately for hopefully happy, healthy pregnancy.
Yeah. So, Jessie, what was that experience like for you, that early? Did you have to make some modifications, like in bladder management, in bowel management, in meds? What are the kind of things that you tackled early on in pregnancy?
So when I first went to see the fertility specialist and doctors, I was kind of worried they were going to be really concerned about me getting pregnant with a spinal cord injury. And I was really surprised that they weren't. They were like, we can do this together. Here are some things we need to talk about. We did talk about bladder and how, like with many pregnant women, it gets a lot harder. And, you know, a lot of women have bladder problems after that, you know, with leakage. Wasn't on a lot of medication. I had been off baclofen by that point, but that was one we had to talk about, making sure I wasn't doing. I think that was pretty much it. I sometimes took a lot more Advil when I was feeling really achy, and they were like, nope, no more. You can occasionally have Tylenol. And quite honestly, I was like in kind of pain near the end, and I really wanted more, but I don't know. You just got to tough it out, is what they say.
Mm-hmm. So. Yeah. How about you? Early on, what were the big changes that you paid attention to?
I mean, early on, not so much. I think around like the 3 or 4 month mark, I was getting really bad headaches. And to be honest, catheterizing is something I've never really gotten down, the intermittent catheterizing. And I asked my OBGYN, Dr. Edith Cheng, if I could switch to a Foley catheter, and she gave me the all clear to do it. And I started using that more when I would go out, since it made me nauseous trying to self-cath in like a public restroom. And towards the end of the pregnancy, I went to a full Foley catheter all the time, actually. But in the beginning, it wasn't so bad until around the 4 month mark.
Mm-hmm. How did you guys cope with body changes? Vanessa, I'll start with you.
Oh gosh, well, I allegedly, I don't have a scale at home, and I highly recommend anybody who wants to get pregnant to get a scale to track your weight at home, because you have to get out of your chair, you know, or they weigh your chair and then they weigh you. And anyway, I allegedly only gained 1 pound by the 5 month mark of pregnancy. So then we went to Barcelona for a baby moon, and I started eating just like everything. Long story short, at the end, I had gained almost 50 pounds somehow. And it was tough. I don't know if you want me to go into those specifics now, but you know, I had gained so much weight. I was having pressure sores on my butt. My OBGYN told me I couldn't do my own transfers anymore. My husband had to transfer me on, you know, in and out of my wheelchair onto the bathroom chair. It was demoralizing and depressing, and those were very dark days for me, actually. So I don't recommend going that route to anybody.
Yeah, so it sounds like there was a little bit of like kind of uncertainty of, you know, kind of being given a green light to eat a lot and then just kind of going a little overboard.
Yeah, I just don't know how that happened though. I mean, I feel like something might have gotten added or subtracted early on there with me transferring in and out and weighing the wheelchair and stuff.
Yeah.
So I highly recommend an at-home scale for anybody that can get one.
Yeah, absolutely. How about you?
With the body changes, it was challenging, mostly fine in the beginning, probably similar to regular able-bodied pregnancy concerns, fatigue, headaches, all that stuff. As you get later into pregnancy, like Vanessa, I gained enough weight, which was approved by my doctor. It was about 50 pounds too. I did, but it's a
I like
lot.
how she points that out right away.
I know. It's a lot, and the transfers were hard. I couldn't really drive very well anymore. So, I kind of lost that part of independence. I started getting, my legs were really achy. I don't know anyone that's 9 months pregnant sleeping super well, but I certainly wasn't. And it was just because my body felt awful. And I don't know if that was spinal cord injury related or pregnancy related, maybe both. But it was an independence for myself struggle, especially at 8 and 9 months.
Yeah.
Oh, another fun one I forgot to mention. I, for the first time, got horrible carpal tunnel syndrome, and I couldn't sleep in bed anymore. This was when I reached month 7, and I would sleep in like an armchair, a recliner, and I would just wake up in the middle of the night yelling in pain, and my husband would have to come wrap like those lidocaine patches around my wrists. And it was like that for a full 2 months,
So I see we actually had found out a little bit about this. Dr. doing his big nodding. So.
Oh, okay.
Yeah, I mean, all very, very common. And carpal tunnel is one that definitely does come up quite a bit for folks with and without spinal cord injury. You carry around, like, the weight changes in pregnancy are not just baby weight, right? You carry around a lot more water weight because your body is doing something to physiologic adapt, right? You're going to lose blood at delivery. So all of that extra fluid on board is insurance for saying, eventually it's going to come out. But some folks retain water a lot better than others. And you end up with some of these sort of weight changes, these swelling changes that can affect your posture, can affect the pressure that you have in certain places, and can end up, in your fingertips and your feet. You get I shouldn't say you get them, you lose your ankles at some point, just all of those changes can be really, really challenging even for folks that have the ability to get up and move.
Yeah. Dr. Crane, I'm curious, from your perspective, how often are you seeing people actually change equipment or call with these concerns? Because, pressure injuries are unfortunately not an uncommon issue with spinal cord injury, having changes in function that don't allow you to be as independent as you used to be. Are those things that people are coming to you for during their pregnancy, or do you have recommendations for what people might be doing even if they're not going to their spinal cord injury physician?
Yeah, I think, so to answer the first part of that, not a lot. People are not coming to us a lot. Occasionally, and again, it just hasn't been that many people that I've worked with over kind of the time of pregnancy and like brand new motherhood. But I think from a rehabilitation standpoint, I think considering meeting with physical therapy on the front end to kind of think about how this might go and have periodic check-ins may be helpful to think about transfers. Think about if you're someone that, because people have all kinds of different situations with partners or caregivers or whatever, thinking about whether if you're someone that normally transfers independently, do you need to use a board temporarily? Do you need to use a lift temporarily? How's your equipment going to go? And then most people after a new baby don't snap back to where they were, 10 months prior, 11 months prior before they even got pregnant. So kind of thinking that through and maybe, engaging the physical and possibly occupational therapists too would be sort of like my advice, I guess.
Yeah. Did you guys need to change equipment? Did you need to have OT or PT assistance during your pregnancies?
I did not. I wish I had, though, and kind of been more proactive and gotten in front of that and, asked for more help. I didn't really ask anybody for help, and I wish I had.
Yeah. I was going to say, I don't think that's uncommon. But
Yeah.
How about you, Jessie?
I did, and I'm glad Dr. Crane said that because I forgot. I did do physical therapy for like the last 6 months of my pregnancy, sometimes once a month, sometimes twice a month, and we would practice because I can stand what standing and transferring looks like, how to do these activities that I was doing safely now that my body was changing. I also qualified for occupational therapy, which ended up being really helpful because my occupational therapist did a lot of research on different equipment and aids for when the baby did come. And here's a way you might be able to pick up the baby. Here's a way you might be able to do a diaper. Here's a device that might help with breastfeeding. So they did a lot of the legwork on sharing that information with me.
Mm-hmm.
I also did have to get a bigger seat cushion. The booty got quite large, and I was pushing up against the thigh pads and needed to go a step up. So I had to go through the process of going through insurance. And if this is something that someone anticipates might happen, start that process early. You know, if you're in a wheelchair, you know how long it takes to get equipment repaired or new equipment. And if it's something that's a maybe, just start it early.
I was going to say, just even the justification for a new cushion, I'm sure took a while. So absolutely. Dr. Burns, do you tend to do referrals to physical therapy, occupational therapy?
Yeah, I think I offer physical therapy and occupational therapy to folks, and kind of depends a little bit on their baseline familiarity with things too. You know, in full disclosure, I am married to an occupational therapist, and so I may be somebody is like in pregnancy who doesn't typically think about PT, OT, but I may be a little bit more biased in that regard. I think
That's good. We like it.
Yeah. I think one thing that I don't think about always, though, is, as Dr. Crane may have alluded to a little bit earlier, is involving the physiatrist if there is a relationship that's outstanding. And I think that's something kind of in pregnancy care. I mean, we are the primary care physicians for this sort of 1 year-ish period from pregnancy through postpartum. And we function as kind of folks to bring in those specialists and to make sure that we're not missing things, gotta dot I's, cross T's. And so I think that is a change in practice that we hope to accommodate.
Well, and it's interesting because I think in talking with all of you, and especially with Jessie and Vanessa, it's like it hits all the hot buttons, right? Of like, you know, mobility, pressure injuries, bowel, bladder, like these are the things that rehab is kind of in their wheelhouse. And so I was actually want to talk about kind of bowel and bladder. You had mentioned already that, you know, bladder function change, that you went to using a Foley catheter. I'm curious about kind of, you know, again, whether there was any other kinds of changes or things that you had to think about beyond some of those initial things. Like, did you end up with more UTIs? It's not an uncommon issue, and yet we tend to handle things a little different in rehab, but I'm just curious. Jessie, do you want to kind of speak to that?
Yeah, I don't think I ended up with more UTIs. I have an indwelling catheter, which was super helpful when you got the belly. It would be really hard to self-cath that way. But I did have, and in 10 years, I'd never really had any leaking, not once. And once I was maybe 6 months pregnant, there was leaking, and it kind of scared me at first because I didn't know what it was, and I'd never leaked. Sounds like it's pretty common in pregnancy, and then it's something I had to be really aware of and make sure that the tube wasn't kinked and that everything was flowing. As for bowel, everything mostly moved along, but I think I got like the pregnant lady constipation a little bit, which is hard to deal with. You know, it's annoying and time consuming, and you've got to be really prepared and dedicated to your bowels, making sure that's taken care of.
How much did your bowel program change?
The time I spent waiting, there was a lot more time. Everything was relatively the same schedule, but I often had to dedicate more time in waiting because I was constipated and needed some help with like an enema, and that just took a long time, or a longer time than it normally did. So,
yeah. How about you?
No UTIs, because the one great thing about a Foley catheter is you can drink as much water as you want, and I'm a big water drinker, and that's why I kind of struggled with the self-cathing. And so I drank tons of water every day. I don't think I got a UTI. Bowel program was great until the 6 month mark. So I go every day. You know, previously I went every single day. I used a little mini enema, and great, like very regular, you know, bowel program every single day. And then kind of like went to every 2 or 3 days. And then I started putting more fiber in my diet. That didn't help. It eventually got to, I was going like 7 or 8 days without a bowel program. And it was horrible. I felt so full and just constipated, and I ended up just not being able to eat very much, actually. And then under the advice of my doctor, I took, some laxatives, and that presents its own issues, and you kind of should be at home, like when you're going under a regimen like that, and not out in your office building in Union Square in the middle of a conference. So, I would recommend working from home if you have to turn to that. So, it was hard those last 2-3 months, and I wasn't eating a lot. And then after I had my daughter, everything went back to normal, like the next day, which I guess isn't even common in, able-bodied people, but yeah, it resumed right away, and everything was great. My pressure sores healed within 3 days of me delivering her, and it was wonderful. But it was not wonderful before that.
Yeah, absolutely. So constipation, common problem, UTIs, common problem. These guys probably know more about it. I don't know. Is it less frequent in people with spinal cord injury who are kind of on top of that, on top of their game, or not?
No, it's very, very common. And I think, pregnancy makes it common even in able-bodied folks, both of these things. Progesterone is to blame for the constipation issues. It just slows everything down. It's why pregnant folks end up with more gallstones, and they end up with more constipation. It's a slow down hormone. I'd say with UTIs, it is much more common in pregnant folks, and the trick with UTIs in pregnancy is that they're more likely to become serious infections of the kidney called pyelonephritis. And so one consideration in patients with spinal cord injuries, if they're prone to UTIs, actually to talk with the doctor about is whether folks should get started on a prophylactic antibiotic. We do consider that sometimes, particularly if you're prone to UTI.
I do have something that might be a good. I'm remembering now that in the beginning of the pregnancy, my urologist suggested that I do a gentamicin flush through my indwelling catheter. And I did that for a while, but maybe you can speak on that. I don't know what happened there.
Yeah,
so.
It's one of these things, again, if you're colonized with bacteria baseline, that's in pregnancy, asymptomatic bacteriuria or bacteria that are just growing but not causing a UTI increases risk for preterm birth, increases risk for kidney infections. And so, again, in someone who's prone to bacterial colonization with an indwelling catheter or prone to UTIs in general, we do consider things like that basically to get a clean start or a good flush before dealing with pregnancy and the issues pregnancy and UTIs have.
Yeah. Can one of you, Dr. Crane, I also was going to ask you about, can you explain what the gentamicin flush, like what exactly that means?
Yeah, so basically instead of taking antibiotics like by the mouth, or sometimes people will be on IV antibiotics if they've got a severe infection, you can infuse antibiotics through the catheter. And you're basically getting like a wash of the bladder. So it's treating at a more local level without potentially some of the systemic effects, which can be helpful because it can change your gut flora and lead to diarrhea and different things. So it just is kind of dealing with the bacteria on a more local level.
Yeah. Changes in bowel function and constipation happen without pregnancy too. Are there kind of things that you think of as a rehab physician that you think, oh, might have tried X or Y versus some of the things that Jessie and Vanessa talked about in terms of kind of waiting it out versus doing some laxatives? Are there other things that you think of to just help with that or might recommend to people?
No, I mean, I think most people that are living with a spinal cord injury are pretty experts on managing their bowel. I mean, particularly if they're the type of person that's proactively doing a regular bowel program. No, I think just being aware that the longer someone goes, often, if you're more constipated, you're going to be then at more risk for a urinary tract infection. You're more at risk for having more spasticity that can cause problems. So I think just trying to be sort of aggressive. I mean, there are different anal irrigation devices and different things that people could try, but that, I think we touched on briefly, like the process of getting a new wheelchair cushion. Trying to get a new device approved is not going to happen overnight or even over a week or a month probably. So some of those things are going to be difficult, to deal with the problem that is here today. But I think just trying to be aggressive, and I mean, if you can try suppositories if you're not already doing that, you can try mini enemas, you can try a whole host of different things that your doctor can work through with you, on an individual level, and just trying to make sure as best one can they're staying on top of it.
Yeah. So say another area just that kind of rehab does a lot of. So, in the future, Dr. Burns, remember that. Just because, again, I think this is one of those things, you guys are experts on your health and your injury, and yet this was a difference. Things changed and then they went back to normal. I'm curious about, you had mentioned having pressure injuries, Vanessa. Did you end up having any issues with that at all, Jessie?
No, I'm a little more ambulatory. Thank
We'll
you.
go with that, yeah.
So I can stand and walk little bits. So I didn't get pressure sores, but I very well could have had I had less function. It was hard to move.
Yeah. Yeah, absolutely. And for you, kind of, how did you cope with that? Because you talked about like you were working up until you couldn't work.
I mean, everybody wants to work until the last minute so that you have more time with your baby, right? So yeah, my work was very generous. They're wonderful people, and they gave me a lot of allowances, and I wasn't allowed to be sitting on my butt anymore. So my husband would go to work and he would set me up on the couch. I'd be laying on my side. I'd have 2 monitors in front of me on a little table, and I would work on my side during the day. And yeah, good thing nothing happened while he was gone. It all worked out. It was great. It was all worth it, is what I want to say. It was all completely worth it. And having a newborn or not being pregnant was so much better than those last 3 months of being pregnant. But yeah, modifications had to be made to answer your question.
Yeah, I was going to say that's a big shift. Other than not being able to drive, what other independence things did you end up having to give up later in your pregnancy as you got bigger, Jessie?
So my husband started his paternity leave early so that he could stay home with me, and I'm glad he did. I couldn't get off the couch by myself anymore. I needed like a boost or a rope or something, man. Even like getting food for myself, because you kind of have to shuffle around the kitchen and reach for this and do all that stuff became a lot harder. And then the belly gets in the way of things. Your center of gravity for transfers, it almost feels dangerous. You've done this for however many years and you get very familiar with your body and how it now works. And then all of a sudden your center of gravity shifts and you just have to be extra careful. It's extra mentally taxing to think about every single move the way you maybe didn't have to before.
Yeah.
You need to make a little basket with like the Covidian pads and like wet wipes and like a cleanup kind of station, and that makes things a lot more helpful to just be prepared and have everything ready in case the worst happens.
Yeah, preparing is always good. So getting to actually giving birth, how much were you prepared for that? Had you made a plan in terms of kind of what was going to happen or not happen? Vanessa, I'll just start with you.
Sure. I asked Dr. Cheng if I could have a C-section. I just didn't want to risk anything happening with not being able to feel the baby coming out. I don't have a lot of sensation below T10. And she agreed, and we chose March 25th, and we showed up. It happened. It was great. But actually, before it was great, they had a lot of trouble numbing me up when they gave me, I think it was an epidural. And it didn't work at first, and they were going to have to put me under and not be able to see my baby come out, and my husband wasn't going to be able to be in the room, and it was pretty devastating. And at the last second, I'll never forget her, and thank you if you're watching this. This medical student that was there tried one last time. She brought an ice pack out, and she was like, "Can you feel this?" And I finally couldn't feel it, and they said they had never seen it take that long on anybody, but it eventually worked. It took a lot longer than it normally takes, and we were able to watch our baby, be born. So it was great.
Yeah, that's great. So what made you decide? I know that it sounds like there was anxiety throughout your pregnancy. Yeah.
Oh, I developed anxiety for the first time in my life that still hasn't left me and probably never will as long as my daughter's alive, you know. You're always worrying about them. I'm sorry, what was the question again?
Just the plan. I mean, all of this kind of culminated in wanting to pick a specific date, be ready to go in. So I'm just curious. We haven't talked about it yet, but I'm curious about that experience for you throughout your pregnancy.
Sure. Well, you know, I asked my doctor when the safest time was to have the baby, and I did, you know, I Googled too, and I guess 39 weeks is when there's the lowest risk, you know, for the baby. And so I said, let's get her out at 39 weeks. My doctor said I could get her out earlier if I wanted to, but I hung in there. And yeah, we picked a date, you know, probably 6 months before, and we stuck to it, and it worked out.
Yeah. I realized that one thing that we had talked about before was that you were not always able to feel with your sensation and
anterior placenta.
Yes.
Yeah. So that, because I couldn't feel the baby kick, which gave me anxiety during my I felt her sometimes, you know, when the kicks were really strong, but my injury plus the anterior placenta, it was just a world of worry if the baby, she was okay the whole time, but you know, I didn't know that, and so I was very concerned that something had happened to her, and if I hadn't felt her kick for a few days, you know, days would go by, even at the very end when I wouldn't feel anything. But she was fine and healthy. Great. Yeah.
Before we keep going, just to speak to that, can you explain what an anterior placenta is and what that actually means?
Yeah. So a placenta, or the uterus itself, you have to think of it in a 3D type of space, right? So you can think of it like a sphere, and the placenta can grow at any point of that sphere. So it can grow on top of the sphere, it can grow in the front of the sphere, it can grow in the back. The front of that sphere, or kind of right behind your belly button, is what we call an anterior placenta. So it's on the front side of your body. And there, right, if you have basically a pillow bag that is the placenta, that is just another layer in between you and the baby, your perception is going to be lowered. And that goes for anybody, truthfully. It is one of the most challenging things and anxiety-provoking things for folks with anterior placentas. It's hard to feel.
Yeah. So it wasn't even that you didn't have sensation; it was also
double whammy.
Yeah, double whammy. Absolutely.
Yeah. Jessie had an anterior placenta as well.
I did. Yeah. I do. Yeah.
Can you? So same thing. Kind of tell us about that, but also just your experience with, you know, planning for giving birth.
Yeah. So I think, you know, one of the first things you think about after you find out you're pregnant is finding out how you're not going to become pregnant. And so I think you guys would probably agree that if you have a spinal cord injury, you should see a maternal fetal medicine specialist rather than an OB. I think so. So that's how I got set up with Dr. Kelsey Ulrich. And I think at our first meeting, I was like, all right, how's this going to work? And she goes, well, if you would like to deliver vaginally and twin A is head down, we can discuss that. That can be in the plan for you if that's what you want. If they're both breech or baby A is breech, C-section, and we feel pretty strongly about that because it's a big safety risk. So if I didn't end up delivering vaginally, but I do remember that conversation, and she said, if you do want to do it vaginally, my only hard and fast line here is that I would really want you to have an epidural, because even though I've never had autonomic dysreflexia, she goes, I would not want the first time that happened in your life to be in the middle of birth. So, you know, if we're going to go with that birth plan, then we need to talk about that. I didn't finalize a birth plan for a while because I wanted to see if the twins were going to switch, you know, turn the right way. I also had a lot of that anxiety about not being able to feel the boys kick. I do have sensation and I can feel, but with a lot of regular pregnancies, they talk about kick counts and wanting to feel, you know, you should feel this many. And I was like, I don't today. Are they okay? You know, do I need to blast some music in there? I don't know. So there's a lot of anxiety with that, and I think that's probably going to be a lot of spinal cord injury pregnancies. Near the end of my pregnancy, I did develop preeclampsia, Maybe it was related to spinal cord injury. Maybe it was related to twins. Maybe it's because I was 36. I don't know, but that had a lot of anxiety with the birth plan as well. So I ended up they kept me overnight in the hospital for a few days when I was, I want to say 35 weeks, 34 weeks. And they said, if you can really get control of your blood pressure, we can keep the kids in. Otherwise, we're going to head down to the operating room. And I was able to keep them together keep the heart rate or the blood pressure reasonable till 37 weeks, which is the maximum. My Dr. Ulrich said she would let me go. With twins and preeclampsia, 37 is the safest. So at that point, it was like another scheduled C-section. They were both breech, and we went in on that day, and 30 minutes later, out they came, and then I was out of there, you know, within an hour, ready for recovery. It wasn't that bad. It was kind of great. It was really great.
It was great.
It was
Just
great. I feel bad saying that.
Show
but yeah.
up, done.
It was
beautiful.
so good. Yeah.
All right. Well, I'm going to
It's
still
only this
ask.
big. The scar isn't that big.
I
It's like
know.
this big. It's yeah.
Okay.
Yeah.
So
I know.
Dr. Bird, speak to this, the C-section versus vaginal delivery versus, and all the things that they've talked about that went into needing to make some of the decisions that were made for both of them.
Yeah, so we can kind of break delivery down into two main factors, timing and mode. I think everybody thinks about mode first, right? Can I deliver vaginally? Is that possible? The answer is yes, unequivocally. There are some things that we have to think about with that. It is true, probably to some degree because it's a matter of preference for some folks, that about 70% of women with spinal cord injuries will deliver by C-section. So again, to what degree that's preference, to what degree that's medically indicated for some reason, it's hard to parse out, but that is where the statistics are roughly. For folks who have a lesion or an injury at T10 or above, that's where we worry about sensation with respect to labor and delivery. And so kind of as you alluded to with the concerns for autonomic dysreflexia, in women of reproductive age, young women with spinal cord injury, it's absolutely right. Pregnancy, labor, and delivery can be the first time that you encounter autonomic dysreflexia. And we certainly get very concerned about that. So epidural anesthesia in those patients in particular is well advised because it basically helps to kind of calm some of that potential dysreflexia that can occur and help us to differentiate a little bit better whether it's true AD or whether it's something that can manifest similarly, which actually is preeclampsia with the elevated blood pressures. If you choose to deliver vaginally, that's great. Kind of the other things that I talk about with folks delivering vaginally are kind of differences with recovery concerns and the process of vaginal delivery. So, you know, for folks who, for instance, may have difficulties with energy conservation and doing the Valsalva, the average person pushing for their first time delivering, unfortunately, is around like 3 hours of pushing effort. And so that's a long time. And so we may talk about things like assisted vaginal delivery with things like a forceps or a vacuum device that may shorten this amount of time that you have to push, but then do have their own risks associated. And I think the biggest one that is a concern for all women, frankly, is that of vaginal laceration. And then for spinal cord injury patients in particular, thinking about care of the area after a vaginal delivery and how that will look. And so there's a lot of conversations we have to have about that if vaginal delivery is desired. C-section, certainly scheduled, like you all experienced, takes a lot of the risk and the guesswork out of it. And so in my personal experience, I think my patients with spinal cord injury and related conditions have chosen to have C-sections as well. I think it's just easier to think about in that regards, and it's nice to have like a day and a time and a plan. The timing of delivery is the other piece, and obstetrical indications aside, I like to always caution folks during pregnancy that that is going to depend quite a bit on how you're doing over the course of the pregnancy. One of the other challenges folks may have with spinal cord injury in pregnancy is their ability to breathe. the baby's pushing up against your diaphragm. It's kind of shrinking your lungs down a little bit. And so if you have related conditions that can expand your uterus further, like extra fluid around the baby or something like that, we may need to consider delivering on the earlier side if we feel like that's a true threat to mom's health. So even though 37, 39 weeks, great, that's term, that's definitely what we'll always aim for. Sometimes we do have to call it a little bit earlier because of those considerations.
I'm curious about also some of the indications for, those decisions being made at the last minute versus planned. And I think, one of the things of thinking about different types of bladder management where people have diversions and things like that, how do those figure into planning or discussions or kind of what to expect?
No, that's a great question. Folks who have diversions, whether they have ostomies, whether they have a Mitrofanov type of catheterization system, those present more complex cases, certainly. Things have been rerouted, and if you are thinking about vaginal delivery, the counter risk you have to weigh is if we have to move emergently for some reason, that could put at risk some of the other things that are going on in the abdomen. So if you've had a significant surgical history, often what we'll do as part of pregnancy or even pre-pregnancy is do some planning about what a surgical incision could look like. So during pregnancy, we would often consider doing an MRI at some point to take a look at what's going on inside, basically, and say, is a C-section in the classic sense, the quote-unquote bikini cut, like the way that we should go? Or do we need to get a little bit more creative with where the surgical incision goes? I've had patients who have needed surgical incisions kind of up here, like kind of up and down and on their left side to be able to successfully get to the baby because of a Mitrofanov and an ostomy. I've had other patients where it's looked pretty good just to kind of do a little bit of a modified down low incision. So everybody's different, but if that's part of your story, then definitely you'll want somebody thinking about that and doing that planning ahead of time.
One of the other questions or comments that Jessie, you made was kind of who should you be seeing? You mentioned, and you're a maternal fetal medicine provider versus just an OB in the community. Kind of what are the pros and cons? Because not everybody is going to have access, I would guess, to maternal fetal medicine providers.
Yeah, I think, one of the nice things about OBGYN is we again have to practice in a community. So it's not just us on our own as cowboys or cowgirls like doing labor and delivery. We have to have anesthesiologists who are around and available and are comfortable with placing potentially complex spinal blocks in patients with injuries like this. We have to have nursing that is familiar not only with pregnancy and postpartum care, but then also be able to facilitate things like Hoyer transfers if needed or other types of specialized care. And so I think most obstetricians in the community recognize if they don't have the resources available and would be honest with patients to say, you may not be best served by seeing us and need to deliver in a more specialized or higher level of care, quote unquote, center. I think a maternal fetal medicine specialist at least consulting during pregnancy is always a wise decision. I think obstetricians in general are more than capable of delivering patients, of doing complex surgeries, of doing anything that I would do, but just the expertise that a specialist like myself would bring to the table would be a little bit more about the intricacies of pregnancy management leading up to delivery and maybe doing a little bit of the behind the scenes, setting the stage for that successful delivery ultimately.
Yeah. So did you guys, when you went in and planned this, did you bring different equipment? What were you ready for when you went in to deliver? You both had a plan, you both had a date, showed up, knew you were going home with babies.
Nothing special related, SCI related. I brought the boppy pillow, which, I'm sure you agree is one of the greatest,
Yeah.
Accessories when you have a little baby, for all sorts of different things. I don't recall bringing anything special into the hospital with me.
How about you?
I don't think I brought a lot that was special. My chair charger, I wanted that. The boppy, I wish I brought it, because when you go to breastfeed, there's like this baby and they're not very good at it and you're not very good at it, and they take like 14 pillows to surround you, but hospital pillows are, like really subpar. But having brought the boppy would have been really spectacular. I think that's probably, we brought our own pillows because we wanted to be comfortable.
How long did you end up staying in the hospital?
For my delivery, it was only 3 days, I think 2 nights, because I still had the preeclampsia, and then I had to have magnesium after, which I think they want you to stay a full 3 if you have to have magnesium.
And was that because of the preeclampsia?
Yeah.
Okay.
It was really gross. It is. It's not, magnesium is not fun, but it's over within 24 hours. A few weeks before that, I was another 3 or 4 days in the hospital with preeclampsia symptoms while they were just monitoring. I felt relatively okay, but they wanted me in the hospital to monitor.
How about you? How long were you in the hospital?
I was in the hospital for 2 nights. I was honestly ready to go after the first night at the end of the day, but they wanted me to stay and be monitored just a little bit longer. And then, we left I think we tried to leave the morning of the 3rd, and it ended up being late afternoon, the 3rd day. 2 nights and 2.5 days.
Perfect. So you talk about that fairly quickly, you had a really good recovery from your scar, from your pressure injuries, from your bowel issues, bladder issues. How quickly did you follow up with your providers?
I had a COVID baby, so I had her like the day Seattle shut down, I think.
Nobody wanted you back.
Yeah. I think I didn't go back I think I went back like a month later. It's hard to recall, but I might have not, because they were canceling a lot of appointments then.
Yeah.
But I was in touch with them, via e-care and everything.
So getting the updates.
Yeah.
How about you?
When I went back,
Yeah, so what was your, did you also have this very quick return to kind of normal, or did you have a little bit longer?
no, I felt so good not being pregnant. People were like, "Oh, are you feeling terrible?" And I was like, "I feel so good." My post-baby sleep was, even with newborns, was so much better. I felt so good. I could breathe. I could eat. I could move a little bit better. It was such a relief that the C-section scar, it was uncomfortable, but it was nothing compared to just being done with that.
Agreed.
Yeah.
Mm-hmm.
It was lovely. I was
Whole
like
new world.
elated. Yeah.
Yeah.
And then I don't know when did I probably come back? Was it a week, a month?
Probably within a week.
A week.
Yeah. I would guess based on, so for folks with preeclampsia, we would often have them come back within about a week to check blood pressure. But yeah, I think for the majority of patients, we would try to have folks come back within like a week to 2 weeks for just a quick check-in visit. And I'll admit, a lot of us are doing more and more of those visits via telemedicine now.
Yeah.
And then have a full postpartum visit at about 6 weeks out from delivery.
Yeah. Excellent. So advice. I always ask at the end for advice, and I realize we need to be wrapping up so we can open it up for some questions. I'll start with Dr. Crane. What advice do you have for people thinking about getting pregnant, thinking about, with their spinal cord injury?
I think probably things I just emphasize a few things that I already said, but I think the few women that I've worked with do have a lot of anxiety even before they're pregnant. So I think often meeting with like an MFM provider usually is reassuring because they get good information. Sometimes they're Googling things, not always the best source of medical information. They may be getting information from a different provider in their own lives, but not necessarily an expert in either spinal cord injury or pregnancy. So, so I think definitely checking in for kind of that pre-pregnancy counseling. I think thinking about meeting with therapy either before pregnancy or early on to just kind of think through, is your equipment going to work or your techniques going to work? Is there any modification? I think those are the main things. And I think it is nice, I'll put in the plug for the rehab doctors, but to maybe check in once or twice during that time, because it's 9-10 months in there, to just kind of keep them posted. But also I think, as you had already brought up, we do a lot of bowel and bladder management amongst other things. So hopefully we can be of some help during that period too.
Yeah, that's great. Dr. Burns.
Yeah, I couldn't have said it better myself. Like I mentioned, a preconception visit is definitely at the top of my wish list. And I think, as testament to some of that too is during pregnancy, it's a relatively short period of time, but both Jessie and Vanessa are able to recall their pregnancy doctors' names now several months, 2 years out from their delivery. It's a very impactful time. And so assemble your team and think about that even prior to getting pregnant, because these are folks who, it's the best part of my job, but hopefully it's the best part of your pregnancy too, aside from meeting your baby, is getting a really tight relationship with your doc.
That's great. What advice do you have, Jessie?
I mean, these guys have the great medical advice. I would just say that people are going to maybe be a little intrusive. They're going to ask, are you going to have a nanny? Did you do this naturally? Kind of maybe ask some inappropriate questions that from people that you aren't close with. And I would say be prepared for how you want to answer those. And I might suggest something like, they're concerned, maybe it's valuable, but inappropriate, and just remind them that you and whoever have decided to do this, and we do lots of hard things in our lives, and we will figure this all out together with my team and my family, and we're really excited looking forward. You don't have to disclose anything you don't want to, and you can go in confidently. They worry that maybe you can't do this because sometimes you have a hard time taking care of yourself. You'll be okay. You'll do great.
That's awesome.
Dr. Crane took the words right out of my mouth. Talk to your doctor, and even after the baby's born, talk to your pediatrician. When you have all these anxieties and worries in your head, you can find anything you want on Google. The internet is a terrible place. You'll start spiraling, and there's more bad stuff than good. And every time I talked to Dr. Cheng, I felt it was like going to therapy. I would cry. I felt so relieved. And they're there to help you. Check in with them, talk to them. They'll make the time for you. Therapy is great. Talkspace is great. That 1 hour a week really, really helps. Most of your worries and anxieties are in your head. Talk to your doctor and talk to your pediatrician, when you're worried about things. Get a scale. Yeah, that's about it.
Excellent. Wonderful. Thank you all so much. We're going to open it up for questions. So the question is about kind of how you recovered post C-section, and did you have limits on being able to transfer, being able to do bowel and bladder program? What were the kind of restrictions from the C-section itself?
Just the one that I think all people with C-sections have, which is not to lift. I can't remember the weight limit, but you're not allowed to lift over 10 pounds or 20 pounds. And yeah, transfers were more painful. But the more you move around, the more you heal. So it got better and better, but it was a little painful in the beginning, definitely. Especially when you're transferring to wash the bottles and do breastfeeding things, if you choose to go that route, or make formula, it's all hard in the beginning.
I would agree. Without seeming too trite, it wasn't that hard. It was uncomfortable, had to be careful. It didn't feel great, but it was not It was not as awful as a lot of people are worried about. I would say I maybe took pain medication twice. I took Tylenol and Advil on a schedule, and that kept things going. But for me, even with the bowels, everything within a week, I was back to moving good, feeling good, and a lot like myself again.
The first period I had after pregnancy was much more painful than the C-section recovery. I wanted to add. That was, yeah, it wasn't as bad as you would think it would be. Mm-hmm.
So a site for helpful equipment. I was going to say we do have a list that will be downloadable, but I'm curious, like, if you could name your top 1 or 2 things that were super helpful with a newborn. I'll start with Jessie because Jessie has the list, but we'll be sharing that. But do you have a kind of top 2, top 3 things that?
Yeah, a couple of them. The Boppy, or the My Breast Friend. Nursing pillow, super great to help hold the baby. If you're doing formula feeding, the Brezza is great. It's like a Keurig machine for formula. My tip for that is if you go that route to get extra funnels, they're $12 because you have to wash them after every 4 feedings. And so instead of washing them, you can put them back in. There's something called a lap belt. My kids are old enough now where I can sit them on my lap and it just kind of locks them in, and I don't have to worry about them as much. And yeah, I think those are my top 3.
The Boppy for sure, and the Gertie, I think it's called the Gertie crib. It's a German company. And we went through a long insurance process trying to get this, electronic crib, and it was a $20,000 out of pocket kind of situation. And after 5 months, they said no, and we found the Gertie crib, and it's this beautiful, it's made for handicapped people, and it's beautiful. It's like beautifully made. It's made by the Amish in like Pennsylvania. And I think if insurance hadn't covered it, it's like $1,000 out of pocket. And we still have it today. It converts into a toddler crib. My daughter's 2.5 now, and we've converted it into a bed for her. And yeah, the Gertie crib for sure.
Gertie crib. That sounds great.
Yeah.
If you were to get pregnant again, what are the 1 or 2 things you might do differently? Who wants to start?
Not it.
Oh, not eat as much, not gain as much weight, for sure. And just not Google, like not get sucked into the internet. I wish I would just put my phone down and just enjoyed the experience, and gone on a walk or like been out in nature and not spent my time wasting my time Googling all my anxieties that weren't ever realized and were never true to begin with.
Yeah, I was going to say, as a psychologist, I would recommend walking away from social media. Yeah. How about you, Jessie?
I think I'd say the same. Physically, I feel like I did everything I could. I feel good about how it all went, but there's so much information on the internet.
All available trained staff, 6 Northeast, room 6256.
The internet and the forums.
All available trained staff, 6
We'll wait
Northeast,
just one moment.
256 Cascade Tower. Code gray. All available trained
It'll
staff,
end just in
6
like
Northeast,
one more repetition.
256 Cascade Tower.
Okay.
So I think we all know this. I was maybe 5 months long before it finally clicked. A lot of the forums and the communities, you get great information there. They are worth checking in on. But remember that a lot of people that go on there are maybe lonely or at a really low point, and they're there to vent. If you're doing really well and you have things together, you don't need to get on the internet and scream about it. So it can sometimes be really negative in those areas, and it can be really scary when people just want to talk about their trauma when really there is a lot of good and a lot of things go right. So when you do Google, because you will, just be really mindful, be very mindful about how long and where you go.
Excellent. So how exercise routine, how much did that change or get impacted by your pregnancy? You want to start, Vanessa?
It was great. I had my same exercise routine, like arm bike, weights at the gym, I'd have a trainer, once a week our work would pay for a trainer to come in and help us, and he would help me get up on certain equipment and strengthen my back. But after about month 6, I had to stop. It was just, I was too big, I was getting pressure sores, and it was too hard, and I think that contributed to my weight gain. So I wish I could have found a way to continue.
I worked out pretty much right up until delivery 2 or 3 times a week. But my workouts started changing the bigger I got. It was a lot of like rolling around and stretching on the mat, and I couldn't really do ab exercises as much. It was like those diaphragm breathing, and it would help me stand and maybe do some squats for myself or rows, but it was like gentle workouts. I don't even know that you would call them a workout. Anyone that watched me probably
Stretching is
didn't
important.
think so, yeah. But they changed, but I was able to go pretty much up until delivery.
Any thoughts on that, Dr. Crane, in terms of recommendations? Sorry.
Staff, 6 Northeast, room 6256, Cascade Tower. Code gray. All available trained staff. 6 Northeast, room 6256, Cascade Tower. Code gray. All available trained staff. Room 6256, Cascade Tower.
Okay, we'll try again.
I think, again, therapists can be helpful in modifying our exercise program to the extent that one can access a pool. I mean, that adds a whole other layer of complexity of getting to a pool, getting in a pool, blah, blah, blah. But a pool can be quite helpful when your mobility is compromised in some way. And if you're feeling big, the pool kind of takes that element away, at least temporarily. And I think just trying to stay as active as one can is going to, I think, have positive outcomes, once the baby's out. Both once the baby's out and kind of getting through the end of pregnancy. And if you choose to deliver, if it works out appropriately to deliver vaginally, I think that tends to help. The more active people have been, I'll defer to Dr. Burns on that expertise, but helps often with the actual delivery. So I think trying to stay active, consider a pool, consider what you can do with your arms, and maybe meeting with a therapist to kind of modify any home exercise program.
Right. Any other thoughts on kind of activity or exercise, Dr. Burns?
Very pro exercise in pregnancy. And even the stretching, the prenatal yoga or modifications to like prenatal yoga are helpful. And yes, as Dr. Crane said, there is some limited evidence that exercise and physical activity in pregnancy increases likelihood of vaginal delivery. So if that's a motivating factor for you, keep that in mind.
That's great. So we talked about carpal tunnel being something that is actually common, even though I did not know that until I talked to Dr. Burns. Other upper extremity issues that can come up, or any other issues that you had? And Jessie, we didn't really talk about this. You have, obviously, with your central cord type presentation, you have more difficulty upper extremity than lower. Did you have any kind of significant changes with your upper extremity function?
I did get a little bit of probably maybe tennis elbow. I'm not sure what to call it. It's probably carpal tunnel adjacent, a little tingling and pain with that. I don't think my upper body worked as well as it did pre-pregnancy, but I don't have any proof or qualifiers that would suggest that. It just felt hard. It felt like things weren't quite working the same with my fine motor skills. Maybe a little more in the neck. I don't know if your neck and shoulders got more sore from maybe just weight or whatever.
Not stretching.
Yeah. So nothing super drastic, but I definitely didn't feel 100.
Yeah. Any things that you guys are aware of in terms of more upper extremity beyond the carpal tunnel?
I think anytime your body is changing and you're having to modify transfers or transferring with more weight, I mean, it's a common thing we see as people age, just with spinal cord injury, totally separate from pregnancy, but transferring as people gain weight certainly affects things. So elbows, shoulders, wrists, hands are all kind of common. The ulnar nerve, maybe the carpal adjacent, kind of runs along the inside part of the elbow towards the pinky side of the hand. So that could certainly get irritated.
Anything else, Dr. Burns, that you think of with
No,
upper
yeah, I
extremity?
think that covers it very well.
Yeah, excellent. So I want to ask one last question about kind of parenting, right? Because with these babies comes being parents. Had you done much thinking, planning, research on what it would mean to be a parent with a spinal cord injury? So I'll.
Sure. I mean, I had Googled, you know, there's one lady, I can't remember what her name is, but she has 3 boys and she has a blog, and I'll have to give you the name of it later, but she, you know, talks about her day to day, and I would read about that. It was nothing groundbreaking or anything. There were a few gems here and there, but no, I mean, I would, you know, I would have to just kind of make my own way and pick my daughter up by her onesie, you know, whether that's safe or not, if I couldn't get down on the ground to get her. And, you know, it all worked out, and it was all worth it, and I found my way, you know, through it. But yeah, just there's a few people online with an online presence that you can Google, and they talk about it.
Yeah, that's great.
I was far more concerned and anxious about becoming a parent than being pregnant. I had such a great team of doctors that they made me feel really confident. You know, at the beginning of this, I said I was really shocked that my doctor was like, yeah, go ahead, we can do pregnancy. You're going to be fine. And so, you know, not having a lot of function, I didn't know what my life was going to look like. And you try to prepare for everything. And everyone always tells you, you can't prepare for everything. And you can't. But looking out and trying to find other wheelchair moms was super helpful. There are some online communities that helped, but you're going to be able to figure it out. You know, you grab by the onesie. You know, if my kid's kind of falling over, I'll use my teeth and kind of yank on the back of their shirt. You know, they become very durable, and they will be your children, and they will learn to do things differently because you're different. And you know, it's going to be the most, you know, beautiful, challenging thing that we do. With being disabled, everything's hard. It's okay. You're an expert in doing hard things. This is just another hard thing. You've got lots of practice at doing hard things.
Yeah, I love that.
So.
That might be a good place to end. Thank you all so much for a wonderful conversation tonight, and so appreciate it. If folks have other thoughts or suggestions or tips or anything, the blogs and things like that, if you could share them with us, we'll share them out with other people as well. So thank you all. Very much appreciate you guys being here tonight.
Thank you.
Thank you.